Very good evening to everyone. On behalf of Cognize Nutrition, I am Shomendo and I welcome you all again. A very important presentation in today's era because for the dietitian, it is very much important to look after the gut. Whatever treatment you are doing on any metabolic diseases or it's diabetes, obesity, or any chronic inflammation, like rheumatoid arthritis or cancer, first and foremost, if you take the history of the gut, if the patient is constipated, patient is having loose motion, bloatings, whatever things are there, even for any neuro diseases or for example, for any psychiatric problems, stress like IBS, you all know it is stress induced. It is related to the gut. So this is very important that today's discussion we were not only discussing on the nutrition, but we will also discuss on the gut-brain axis, which is a two-way communication system linking the emotional and cognitive centers of the brain with the peripheral function in the GI tract or the gastrointestinal tract. So it relies on the key component like the central nervous system and their enteric nervous system that Shreya will discuss, gut microbiota. Anyone can unmute and say which is the nerve which connects the gut and the brain, except Shreya and me. Anyone can say which is the nerve that is connecting your or that is transmitting the sensory signal from the gut to the brain stem and the motor signal back down. That is two-way connection. Do you know the name of the nerve?
Yes, sir.
Yes, please tell.
So vagus nerve.
Yes, Annesha, you are old student. I was expecting from the new one. So thank you, Annesha. It is great to know that it is vagus nerve and it's the longest nerve and trillions of microbiota produce the active chemicals. Even the happy hormone like serotonin also, please mute yourself, everyone, is also secreted from the gut and the GABA also. So the influence, if your gut is not okay, even Hippocrates has told long back that all diseases begins in the gut. So let us understand the story of the gut, and it is very interestingly Shreya Bhattacharya, she will present. So I welcome you, Shreya. You are already our cognized family member and from our batch 9. I will like that Shreya, please introduce yourself, say few words about yourself, from where you belong, from where you did your masters, etc. Then you start directly the topic. Thank you, Shreya.
Hello everyone, I am Shreya Nandy. I have done my BSc from G.D. Birla Institute and my masters from NSHM Knowledge Campus. I have done a short-term course in VLCC regarding child nutrition. Apart from that, I have attended few conferences and now I'm doing this course under Sir. So before I begin this presentation, I would like to express my heartfelt gratitude to Shomendu sir for giving this platform, and thank you sir for your unwavering support. I would also like to thank everyone present here and for your time and attention. Now I would like to begin my presentation. My topic is the gut-brain axis. So what is the gut-brain connection? The gut-brain connection is a two-way communication, as Sir said, where the brain and the gut constantly exchange information through the nervous system. The gut contains millions of nerve cells, often called the second brain, which help regulate digestion and also can influence emotions, mood, and our overall health. Now, what is the purpose of the gut-brain connection? The gut-brain connection helps the brain and the gut work together to ensure the body gets the nutrients it needs and so that it functions properly. It also linked with our emotions and digestion, so stress and feelings can affect the gut, which you all know. While the gut discomfort can increase if the stress level increases, and then it influences our mood. Now, what type of body functions does the gut-brain connection affect? It affects our metabolism, immunity, movement of food through the digestive tract. It is also affecting our mood, stress, behavior, pain perception, cognitive function, showing that a healthy gut is more important for physical and mental well-being. Now, this is an anatomy. This slide illustrates that is a gut-brain axis, which is a two-way communication network between the brain and the digestive system. It shows that how our brain, gut nerves, hormones, immune system, and gut bacteria are constantly interacting with each other to influence both our physical and mental health. Now comes the function of the entering nervous system, which we know that is also known as the second brain, because it controls our digestion independently while communicating with the brain. It also regulates our gut movement, digestive secretions, blood flow, hormone release, and also plays an important role in the gut's immune function. Now comes the function of vagus nervous system. It is the main communication pathway between the brain and the gut. It controls mainly the automatic body functions such as digestion, heart rate, breathing, immune responses, saliva productions, and bladder function, while also helping regulate mood, speech, taste. This makes it a key part of a gut-brain axis. Now comes the role of gut microbiome. The trillions of beneficial microorganisms living in our digestive tract. These microbes help digest food and produce energy, protect the body from harmful pathogens, support and regulate our immune system, then strengthens the intestinal barrier to maintain a healthy gut. A balanced gut microbiome is essential for our overall health and proper gut communication. Now comes the conditions and disorders. Conditions and disorders may be such as IBS, constipation, anxiety, depression, and chronic stress. Research has also suggested that an unhealthy gut microbiome may be associated with the neurological disorders like Parkinson's disease and autism, though these links are still being investigated. Then comes the treatment. It can be of several ways, including the probiotics to add beneficial microbiome, antibiotics when we know that we take antibiotics when harmful bacteria needs to be treated. And what is the fecal microbiota transplantation? Is selected when the medical condition to restore a healthy gut microbiome. Now, there are different ways of therapies which we can incorporate in this. And the first comes the relaxation therapy, then comes the cognitive behavioral therapy, gut-directed relaxation training, and comes the biofeedback. Now we can talk about the diet. Diet includes soluble, insoluble fiber. As you all know that most plants have both kinds of fiber, which help keep our bowel regular and feed the helpful microbiota inside. Prebiotics and probiotics. Probiotics are the live bacteria and the fermented food like yogurt, and prebiotic are the fibers and complex starches that these bacteria like to eat. Antioxidants, which we know that occur naturally in a variety of fruits and vegetables, help to fight free radicals in your body and prevent inflammation. Now comes the anti-inflammatory foods. A whole food, plant-rich diet is naturally anti-inflammatory because it reduces sugar, additives, and cholesterol. This helps keep your gut microbes happy. Omega-3 fatty acids found in salmon, flax seeds, walnuts have inflammatory property. They help in reducing the inflammation associated with the GI disorders and also help in cognitive function. Bone broth, rich in collagen, amino acids, bone broth can help repair the gut lining and also reduces inflammation, which can positively impact our neurological symptoms. Now comes the turmeric. The curcumin that is found in turmeric is a compound known to have again inflammatory and antioxidant property. Turmeric can be beneficial for soothing the gut inflammation and supporting our brain health. So these are the exercise which you can incorporate. Regular activity is important. Moderate exercise, including strength training, aerobic activities for our gut benefits. Hydration is very important, and in between break is also important. The heart and the gut. We all know that the heart and gut are connected to each other. So we know that it influences the heart. And this explains that, however, if there is a certainly have a leaky intestinal barrier associated with increased permeability for bacterial ball products, an impaired intestinal barrier function will be followed by bacterial translocation. These pathways and the most recent insight into the impact of the gut on acute and chronic heart disease will be discussed in this review. Gut health and the mental health elevating. We all know that gut health is linked with mental health. So it alleviates our anxiety. So what are the symptoms? We can see nausea, vomiting, cramping, abdominal pain may trigger which is already existing, like digestive conditions, for example, IBS, irritable bowel syndrome. There are 5 therapist-approved tools for managing a GI anxiety and gut disorders. So the first is the cognitive reframing. Over here, what happens is that it is the in it's in learning how to track these related activities when stress and IBD symptoms. For example, instead of the pain means my whole day, think about it, the pain means my whole day. Try saying,
Shreya, your voice is breaking.
Try saying, sir,
না ঠিক নেই
sir,
নো
এবার শোনা যাচ্ছে স্যার?
হ্যাঁ হ্যাঁ
Try saying, I have managed before. I have full support my gut and nervous system. This is a skill which we should inbuild in ourselves.
Shreya,
Next
once
comes
again
the
you go back.
exposure.
Shreya, you stop sharing the screen and just come to the main screen. You have just switch off your video and speak without sharing the screen. Sometimes it can improve the network.
আমি স্লাইডটা
Chandrani,
দেখতে
please don't type anything in the chat box. Already I am coordinating.
আমি স্লাইডটা স্যার কি করে
এবার কথাটা পরিষ্কার আসছে। Again you just
আবার এবার স্লাইডটা শেয়ার করব, একবার
করো।
দেখবো স্যার?
হ্যাঁ করো। Let us try, না হলে ভিডিও অফ করে করবে।
আচ্ছা ঠিক আছে। এবার হচ্ছে স্যার, শোনা
না
যাচ্ছে?
ক্লিয়ার আছে, শোনা যাচ্ছে। Just few lines back you just again repeat.
হ্যাঁ আবার ব্যাকে যাব, এটা তো?
এটা হ্যাঁ।
Cognitive reframing. It helps us, it supports the patients in learning how to calm down and
না সেম
IBD
হচ্ছে।
state.
It is again happening the same. Same. Then you try switch off your video and continue. Switch off your video and then continue.
Just a second.
Just go back and switch off your video. By that time, everyone can put your question in the chat box about the heart brain axis. Also, you can put in the chat box. or by that time I may continue. হ্যাঁ এখন একটু শোনা যাচ্ছে, yes.
I have managed this. এবার শোনা যাচ্ছে, sir?
হ্যাঁ 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 হ্যাঁ
In For example, if we think about the pain, like it is ruining my whole day, try saying I have managed this before because I have tools to support my gut and nervous system. Now comes exposure, rebuilding confidence gradually. Avoidance of food, bathroom, school, work, or social settings can increase fear and sensitivity over time. Exposure-based strategies help patients gently re-engage with avoided situations, supporting long-term IBS, pain relief, reduce anxiety, and improve quality of life. Gut-guided imagery and hypnotherapy. Does hypnotherapy work? Clinical trials show meaningful sustained improvement for many GI conditions.
Shreya, can you go back and switch off the video?
আচ্ছা, শোনা যাচ্ছে তো?
না 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 শোনা যাচ্ছে না, you please do, otherwise we are wasting our time.
হ্যাঁ ঠিক আছে স্যার।
At the last you
ঠিক
again
আছে,
switch on your video.
আচ্ছা।
You speak, screen
হ্যাঁ।
share পরে করবে,
Now
আগে
come-
speak, you try.
হ্যাঁ, simple stress relief practices. Stress doesn't cause IBD or IBS, but it can worsen our symptoms. Tips for anxiety. What are the tips you can incorporate? Practice breathing exercises. Find a creative activity like painting, dancing, yoga. Take care of your sleeping routine. Ask for help if you need help. Focus only on the present. Stay active as much as you can. Take a pause and hydrate yourself. These are the supplements for anxiety. We know vitamin D3 can improve our mood and energy. It has been a must for many of my patients throughout the pandemic, says Dr. Madra. While sunlight isn't a sole contributor to anxiety, vitamin D deficiency can also hinder our mental well-being. As the suggested dose is 2000 international unit for most adults. Now comes magnesium. We know that it helps in managing anxiety and insomnia by regulating our serotonin and improving our brain function. The suggested dose is 1 to 10 milligrams before bed. Now comes omega-3 fatty acids, which is found in fish oil and also in small shellfish. These compounds are best known for their benefits for the cardiovascular health. Suggested dose is 1000 to 1200 milligrams a day. Then comes chamomile tea. It helps in soothing our brain and also due to an antioxidant which contains antioxidant known as apigenin, which binds with specific receptors in the brain to decrease our anxiety. The suggested dose given is 800 to 1600 milligram around 30 minutes before bed. Now comes valerian root. Works well with the GABA receptor and subtly increases its levels, says Dr. Madra. The suggested dose is 300 to 600 milligrams before bed. Now comes ashwagandha. Is also considered as an adaptogen. Ashwagandha is a natural substance that has a sedative effect and helps the body to adapt to stress by decreasing the cortisol stress hormone. Suggested dose is 500 to 1000 milligram daily. Now comes kava. Kava causes dopamine levels to rise and works with other receptors to reduce anxiety symptoms. Some people describe kava's effect as euphoric. Suggested dose is 1000 to 1400 milligrams daily. So this is a photo given of ashwagandha for anxiety and mood. Now I would like to conclude by saying that metabolism depends on our digestive organ as well as the bacteria and microbes that live inside us. These are what actually consume our food and help us absorb the nutrients that they contain. One way to support it is by eating more fiber and less sugar. If the good bacteria die off due to lack of food, it can also give the bad bacteria chance to take over the good bacteria. So
Mr.
the
Anup Pal, can you please mute yourself? Thank you so much.
So the right diet can support the gut-brain axis by helping the good bacteria outcompete the bad. So our dietitians recommend filling 2/3 of your plate with vegetables, fruits, whole grains, beans, nuts, seeds. The remaining 1/3 can be of lean animal protein and plant-based protein. Thank you.
Thank you, Shreya. Though in between there is a network glitch from your side, but later it is
Really sorry
very
for that, sir.
no issues, no issues, Shreya. Just to conclude from my side, you can stop sharing the screen.
Okay, sir.
Don't do that. Don't do that. Yes, yes, this one, yellow one. Minimize the screen.
Yes, sir.
Come to the main screen. Now, please, can you stop sharing?
Stop.
Yes, now it is good. So it is really very crisp. Within 20 minutes, you have concluded. You have given us a gist, but it is a very elaborated topic.
It's a very
And
wide
as
topic,
we
very wide and
very high
detailed.
topic. So, I was little bit expecting more to hear from you because you have touched upon very important point. So মনে হলো যেন এটা খুব তাড়াতাড়ি শেষ হয়ে গেল একটুখানি যদি কন্টিনিউ
টাইম কনস্ট্যান্ট ছিল স্যার, টাইম কনস্ট্যান্টও ছিল, একটা টাইমেও শেষ করতে হবে ওয়াইড।
But the thing is, সবার কাছে কোশ্চেনে আসার আগে I will say that she has also highlighted about the heart gut axis. That is also important. We are always saying gut brain, but even gut used to speak with the heart also. That need to be very much even important. Even she has highlighted, Shreya has highlighted on the fecal microbiota transplant. Although it is being covered in the syllabus of MNT during our gastro-liver classes, but anybody from our students, do you want to say anything about the fecal microbiota transplant and why it is being done? What is the reason of fecal microbiota transplant? Though it is not established everywhere in India, but still it is very important mode of treatment, especially in the IBD cases, IBS to some extent. So what is being done and why it is being done? কেউ যদি বলতে চাও বাংলা, you can say. No one? For what it is being treated? Shreya, you can highlight one line about FMT, fecal microbiota transplant.
স্যার আটকে যাচ্ছে না?
না, শোনা যাচ্ছে।
না, বলছি আপনার স্ক্রিনটা আটকে গেছে।
আচ্ছা, it's okay. It is from your side only. You just tell why it is being done. Fecal microbiota.
এটা
Acha, it is a procedure where it is just from the
বলছি এটা একটা মেডিকেল প্রসিডিওর যেটা কি হয়, দ্যাট ট্রান্সফারস দ্য প্রসেস টুল, মানে হেলদি ডোনারের থেকে নেওয়া হয় ইনটু আ পেশেন্ট গাট টু রিস্টোর আবার হেলদি ব্যাকটেরিয়াকে।
yes,
সেই জন্য এটা করা হয়।
so this is the another invention or the treatment we would like to say that is also very important.
আর স্যার একবার গাটের হার্টটা একবার বলবো, আবার
একটু বললে ভালো হয়। হ্যাঁ, আমি শুনতে চাইছিলাম, হার্ট নিয়ে বেশি কথা হয় না। হার্ট নিয়ে
জানি সবাই যে হার্ট আর গাট সব অর্গানসের সাথেই মানে গাট ইন্টারলিঙ্ক। তো এবার কেন কি হার্ট আর ক্লোজলি দে ইনফ্লুয়েন্স ইচ আদার। এবার কি হয়, যদি আনহেলদি গাট হয় তখন কি হয়, হার্মফুল ব্যাকটেরিয়া এন্ড টক্সিন এন্টার করে আমাদের ব্লাড স্ট্রিমে। এবার কি করে এন্টার করে কজিং ইনফ্লামেশন হয়ে যায়। তাই সেই ইনফ্লামেশনের কারণে কি হয়ে যায়, আমাদের হার্ট রিস্ক হয়ে যায় হার্ট ডিজিজে, সাচ অ্যাজ এথেরোস্ক্লেরোসিস এন্ড হার্ট ফেলিয়ার। তারপরে পুয়ার হার্ট ফাংশন থেকে ক্যান রিডিউস দ্য ব্লাড ফ্লো টু দ্য গাট। weakening the gut barrier and creating our harmful cycle.
Very
Sir,
good.
how
Very
the
good.
gut
So
affect
from
our
long
brain?
time, I think Mr. Anup Pal is waiting, and you are a student or like a practicing dietitian, Mr. Anup?
How the gut affect our brain?
It is already being discussed in the presentation.
Is it
You are a student. You are a student, or you are Anup? Are you a student, or you are practicing, or you are a teacher, or can you please tell about yourself, Mr. Anup? Can you please unmute? Sorry. Even the question is not clear from your side, because from your side the network is breaking. Hello? Paramita, please ask him to call me after this presentation, because he has a lot of a grievance in the chat box, though from his side the
Can you
network
hear
there is
me?
a... Yes, yes. Yes, Mr. Anup, you can say. I think, sorry, it is the network problem from your side, so we cannot hear you. Sorry for the network glitch. So you have put a grievance in the chat box also. Sorry for that. That's due to some network issues, it can happen. And the speaker is trying her level best to coordinate with us, and we are trying our level best. So it is not that technical glitches are always there. But sorry, we cannot hear you. If you have any question, you can connect with me. Shreya, anyone, any question? But before Shreya says, I would like to say for every dietitian from last maybe 1 or 2 years, I have dedicatedly starting money, whatever I have started in the beginning also, that if a diabetes patient is also coming to you, mostly diabetes comes to us, obesity is very common, comes to us. Before restricting the calorie, talk about the gut. What is gut-brain axis? How often, even many pediatric nutritionists are coming, pediatric patients are coming to me. So most often we see, Shreya, in the pediatric patients or in the child, this is the dysbiosis of the gut. And there is irritability, ADHD, attention deficit, inattention is very high. So they are trying to give different types of omega-3 supplements. They are very much worried about the child, about their inattention, overactivity. But even it is very, very true. I want to
hyperactivity যেটা
hyperactivity যেটা সেটা আমি শেয়ার করতে চাই তোমাদের সবার সাথে, যে গাটকে ঠিক করার পরে miraculous result I got. Miracle result I got, and it is বাচ্চার পুরো হাইপার অ্যাক্টিভিটি ঠিক হয়ে গেছে যখন গিয়ে দেখা গেছে বাচ্চার ফাইবার ইনক্রিজ, ওয়াটার ইনক্রিজ, অ্যান্ড প্রোবায়োটিক দেওয়া হয়েছে, প্রিবায়োটিক আমি ইউজ করেছি। ইউজ করার পরে দেখা গেছে যে চাইল্ড হ্যাজ গিভেন ভেরি গুড রেজাল্ট, মানে রিসিভড ভেরি গুড রেজাল্ট। অ্যান্ড বাচ্চার মা বলছে অদ্ভুতভাবে ওর হাইপার অ্যাক্টিভিটি অনেক আগের থেকে কমে গেছে। সো দিস ইজ ভেরি ভেরি ইম্পর্টেন্ট। ইভেন ডায়াবেটিস, ইউ ফার্স্ট ট্রিট কনস্টিপেশন। কনস্টিপেশন একটা জিনিস যেটা ট্রিট করো, আদার তো লাইফস্টাইল হ্যাবিটস, ওয়াকিং, ড্রিঙ্কিং ওয়াটার, sleep time, everything is related. But if you reduce, especially in the geriatric patient or the aged patient, if you treat constipation with natural fiber, even Pycelium husk has a very good role in that. So if you do, you can get very, very good result. Constipation treat করে দেখো, postprandial blood glucose অনেক কমে গেছে। So from today's take home, if you, all those who are practicing dietitian, even for the students, few message if you take about the connection of the gut-brain axis and what it is actually being doing. So scientists have not come to a conclusion about the different species of bacteria. Many species of bacteria is not being invented yet. So it is a miraculous things what our gut bacteria or the tiny microbes are doing, which we can never see through our naked eyes. That is important. So অনেক সময় আমরা বলি যে ফাইবার এতই কম খাচ্ছে যে বাইরের থেকে প্রোবায়োটিক সাপ্লিমেন্ট নিয়েও কোনো লাভ হবে না। And I will request after today that please calculate everyone your own diet chart. আমরা যেমন কার্বোহাইড্রেট, প্রোটিন, ফ্যাট ক্যালকুলেট করি, ক্যালকুলেট করে একটা মজার ব্যাপার দেখো যে তোমাদের ডায়েটে সারাদিনে ফাইবার কতটা খাচ্ছ, কতটা ফাইবার খাচ্ছ। শাক সবজি ফল খাও এবং সবই NIN এর বুক থেকে ইউ ক্যান ক্যালকুলেট। দ্যাট ইজ ডান। থ্যাংক ইউ। Any more question? Anyone to like to share anything? Annesha?
এখানে লিখেছেন স্যার একজন অ্যাঙ্গার ইস্যু।
That is one of the factor of psychological issue. So that can be controlled. Yes, but that is not the like only fixing the gut you can prevent your this kind of issues. But this cannot be a treatment. Though this treatment pre and probiotic prevented, yes, it can be little bit prevented. But there are many practices, mindfulness practices, medication and meditations both may be required.
Very important.
Lifestyle is very much required.
বেসিক্যালি পজিটিভ আউটলুক হওয়া চাই। পজিটিভ আউটলুক থাকলে অনেকটাই গাটের প্রবলেম চলে যায়।
Thank you, Annesha. So Annesha is already doing very good practice in Haldia, and she is also having 2 kids. So Annesha has given the first answer. Okay, so I would request everybody can unmute. All are our students, so why you are typing in the chat box and doing some formalities? Chandran, you can unmute and share your thoughts. And those who are from the batch 9, if you have any question regarding the next presentation, you can ask me. I will request somebody do on the heart health and gut, importance of heart health and gut. Somebody can do on this. Somebody specifically can do on magnesium. Magnesium is very important. So you can do this on magnesium. Very sorry to say when I am talking, somebody please don't unmute yourself. If you have to say, yes, you can say now. Let us wind up the session. I think nobody has no question yet. So, Shreya, can you see anything in the chat box, or Paramita, can you say anything? Anup?
এখানে জাস্ট ওইটাই, মাইন্ডফুলনেস ইজ ভেরি ইম্পর্টেন্ট।
And everybody is thanking you, Shreya, for choosing this wonderful topic and my favorite topic, one and more.
ডিটেইল ওয়াইড আরো যায় পড়ো হতো।
হ্যাঁ, করো তুমি এটার পরে নেক্সট আমরা একটা এপিসোড আনবো। এটা আমাদের খুব ভালো লেগেছে আজকে। অন্বেষা বলো।
Sir, I want to hear something from you about gut-brain axis because you are working enormously with this field.
Okay, so one presentation I think you have seen, the recording is also there. I have put like last year I did with Dr. Debanjan Pan. So that time I think Annesha, you have also I think joined that presentation. I will remind Paramita to share again. And again, if I get a scope, I will obviously do with this. Because binge eating and psychological disorders have a very good studies even with the gut. Anup is raising his hand from a long time, but due to his network problem, Anup Pal cannot unmute. Anup, you can say what you want to say, then I will wind up the session. Sure. So thank you, Shreya. It's a wonderful session once again. And thank you all the audience for joining. So I think 8 p.m. we all know that we have a type 1 diabetes session. So you can enjoy that. That will be in Bengali. And those who have registered, from that registered link, you can join and you can do that.